he definitely has Facet syndrome. You can see he's completely flat-footed. This would be a really great technique that would alleviate all your symptoms pretty quickly. Most people get better, they see at least a minimum of 50% pain reduction in 4 weeks. All right, folks, this is Dr. David Kulla here with Antonio, who found us on YouTube, right? But Antonio, you know, a lot of people know chiropractic, great for back pain, of course, yes. He has back pain, but he has, well, why don't you tell us what's going on with you?
Well, my lower back, I got stiffness.
Okay.
I have a hard time getting up in the morning.
Okay.
When I also get up, I stay hunched forward,
Mm-hmm.
and I cannot stand straight
At
as
first.
I get up in the morning at first.
And then it loosens up?
And then it loosens up, but it takes such a long time to loosen up.
Okay.
So I have trouble breathing, gasping for air.
Okay, he's also been in, sorry, I'm interrupting here, but he's also been in a motorcycle accident, so, and a bad one. He had hand surgery. We'll talk about that in a second. We're going to do cold laser on the hand surgery, all the damage there in the hand. But, you know, obviously a motorcycle accident. You also had a weightlifting, a squatting incident where you hurt your back.
Right.
And that was about 12 years?
12 years ago, right.
Okay, okay. So, and you said you had an old X-ray with a wedged disc.
Right.
So that tells me everything. Just think about what he said. Without even touching him, I already know what's going on, but I'm going to double check all my work here. But right away, he told me that his back locks up and it's hard for him to stand upright. So that alone right there either means spinal stenosis or Facet syndrome. And it's probably Facet syndrome because he just told me he had an X-ray where his disc was wedged. And Facet syndrome shows like a wedge disc. It's like a cheese wedge, right? But the disc should be thick in the front and the back. It should be uniform, the same thickness. And in that situation, it's not. And I'll show you here on a model what happens. You can come on over here and take a look. So right here is your sacrum. And that wedge means your sacrum is pushed back, your abs are weak, and your belly drops down. It's called lower cross syndrome is another name for it. There's a few technical terms. Facet syndrome is the medical term or the chiropractic term. Lower cross syndrome is the physical therapy term because it is a postural imbalance. So the problem with that is if you see the nerve right here, folks, it sticks out here, and you can see here, Antonio, on this side, right? But the sacrum, this piece of the sacrum, the facet joint, when that sacrum tilts forward or the bottom of it tilts back, the facet goes in and pinches that nerve right there. You see that? And folks, you can see it right here. If you do this with the sacrum, the facet joint right here opens up and it gives more room for this nerve to breathe. But when you sit down on your tailbone, people that sit like this all day, that facet joint pushes forward into the L5 nerve root. And that's why you can get sciatica, back pain, or why you can't stand up after a while. That's what's going on with you. So there are a lot of things that can help. Just traditional chiropractic care can help with that. You can't really avoid sitting. You have to sit. So there's a thing called a sacral wedge that you can sit on. So if you have a sit-down job, folks, and you have this problem, just buy a sacral wedge. It'll give you a couple extra hours of sitting more comfortably. But the biggest mistake people make is you have back pain like that and you just want to do this, right? And it feels so good, doesn't it? To stretch your hamstrings, but you're kind of worried you can't get back up, maybe?
Right.
Yeah.
I have to actually support myself to come down to
Yeah.
myself.
So you're having a bad case of it. Most people have a mild case of it. This would feel great, right? That's not the exercise you want to do. Your pelvis is tilted forward, lower cross syndrome. So it's pulled forward, so your quads and hip flexors are tight because you've been sitting all day. What do you do for a living? Do you sit all day? You don't have to tell everybody. But
overnight, I sit all day.
you sit overnight.
Yeah.
So sitting in a chair. And the lower the chair is, the worse. So you want to make sure when you're sitting that your hip is a little bit higher than your knee. Just slightly, like an inch or so. Okay? That's a good nugget right there to know. If your hip is lower than your knee, you're definitely going to have hip flexor problems, and then it's going to be harder for you to stand upright at first, especially after you get out of the chair. Okay, so we're going to go ahead and muscle test him and just take a look and make sure that my diagnosis is right. So go ahead and lay down on your stomach. Okay, so this might bother your lower back. So I could tell when I do this with his legs and I bend them both, his butt lifts up in the air. He does that because otherwise it's too much pressure on his lower back when I bend both of his knees. Watch. You feel pressure on your lower back? Yeah. It doesn't feel good. So he definitely has Facet syndrome. And again, on the physical therapy side of it, they would call that lower cross syndrome. And they're both are right. The advantage of seeing a chiropractor is you can have the manipulation done on the joints itself of the spine. And I don't know that I would want to get adjusted by a physical therapist unless he had a background in manipulation. But then you can also get the exercises for lower cross syndrome. You can get that off the internet. We did a video on lower cross syndrome exercises. I'm going to give you those too as well today, okay? Tender right there?
Yeah.
Okay. And any tenderness out here?
Yeah.
Okay. And how about out here? Okay.
Yeah.
Do you get headaches at all?
Oh. Yes.
You do? Okay. How many headaches do you get on average a week?
Not much.
Okay. When was your motorcycle accident?
2009.
9, okay. The same year you had the squatting incident.
Uh-huh.
Turn over on your back. Now, since he already had x-rays after the accident, we don't need to take another set of x-rays. He hasn't had any new accidents in the last 5, 6, 7 years. We're going to go ahead and raise this leg up. Any back pain here?
Oh, yeah.
Okay. Back. Any leg pain?
Uh-uh.
Okay. Do you ever get any pain shooting down your leg? Okay. Lucky. Any back pain here? Or hip pain? Okay. And any back pain here?
I feel stiff though.
Okay. And how about any shooting pain down the leg there? Okay. And how are we doing there? Where do you feel that?
I clicked.
Yeah. Okay. Relax there. Let's see your hands up in the air. When did you have surgery on your wrist?
A month and a week.
Month and a week. Okay. And what have you been doing for it since?
I just got off a cast.
You just got the cast. Are you doing physical therapy for it?
Yeah.
Okay, good. Seeing a hand specialist, physical therapist?
Right.
Perfect. Okay. And did they give you exercises to start doing?
Right, yes.
Okay, great. Are they doing any cold laser therapy on the hand?
Cold laser?
Mm-hmm.
No.
That's something I would recommend doing. It'll help heal it a lot faster. Okay? Heal and repair all the soft tissue damage, all the scar tissue.
Oh, yeah?
Really effective. And also for pain as well. Yeah. Okay, come on up. Have you sit up. Ready? I'll help you. Yeah, that's the best way to turn to your side. I'm going to help you here. Okay. Swing your legs around this way. How old are you?
50.
50?
Yes.
All right, come on over here. We got to get you moving like 50 again. You look like you're 65. So what we're going to do here, besides getting you back to your youth, we're going to test you here. All right, we're going to test your feet. We're going to look at the arches in your feet. I want to make sure there's no nerve damage in the back, and this can tell me a lot. Also, it's going to tell me a lot about what's going on with the arches. You look flat-footed to me. So you're going to step up here. You're going to enter all your information, and then we'll go from there. Okay, we just scanned Antonio's feet. He is really flat-footed, and you're going to see his feet right now. So, Antonio, come on over here. Take a look here at his feet. This is a properly balanced pair of feet right here. Top pair of feet. You want the red on the ball of the feet the heel of the feet and evenly splayed across the toes. Okay? That's what you want it to look like. The blue on the inside is the medial arch. The green on the outside is the lateral arch. And that little indent right there, that peanut-shaped indent, is the transverse arch. Now, when you scale back here and you look at his feet, you can see he's completely flat-footed. Medial, lateral, and transverse arch gone, red all over the foot, darker red on the left foot, which tells me he puts more weight on that left side. He got a score of 171. That's severe pronation. But look at this. See this bar up here on the right and the one on the left? That shows me there's a huge imbalance in his arches. He's putting so much more pressure on the inside of that left foot. That's creating a lot of your back problems. Okay? You have to get that fixed. If you don't get that fixed, this will continue to be a problem for you. Because when you're flat-footed, if you stand back here, I'll show you. When you're flat-footed like this, you rotate your knee in. Do you have any knee problems, by the way? No, not yet. And then what happens, the hip rotates forward. Remember I was talking about lower cross syndrome, where the hips come forward. And when you're flat-footed, that makes the hips rotate forward even more. So that has to be fixed and addressed, okay? But let's go ahead and get you started, and we're gonna adjust you. You ready? So because he has Facet syndrome, we're gonna put him on this flexion distraction table. This is not the Cox table, but it is a Cox technique table. It does flexion distraction. The nice thing about this table is it does auto flexion. Because he's not having any neurological pain down into the legs, we are going to put him on auto flexion distraction here. Start him with some heat. Have you ever been to a chiropractor before, Antonio?
No.
No, okay. Not every chiropractor practices this technique, okay? So you're gonna hear some noise with the table. Nothing to worry about. That's going to do right there is open up that little space where the facet joint was pressing in, the wedge that I showed on the model there, right? So this is going to open that space up right now a little bit. And then I'm going to come in there and do some more work on you, okay?
Good.
I'm going to give you some heat just to loosen things up. Relax there for about 10 minutes. All right, so now we just did about 15 minutes of auto flexion distraction for Antonio here. Now we're gonna get in there a little bit more. Again, I would never put somebody on auto flexion distraction if they had radicular symptoms, pain into the legs, neurological symptoms. He does not, so that's good news. Now, Antonio, you're gonna feel some pulling in your back. It's not gonna be painful at all, okay? How you doing there, okay?
Okay.
So what this technique does, Cox Flexion distraction technique, it provides foraminal gapping. So it opens up that foramina, which I showed you on the model, closes up the hole of the L5 S1 nerve root when the sacrum pushes forward. Okay, so we're going to take his lower back lumbosacral joint, L5 S1, out of hyperextension. And if you look right up there on the poster, the second picture on the middle picture on the top, Facet syndrome, you'll see exactly what we're doing here. Right here, if you guys zoom in, you can see that we're going to be opening up this space here where that nerve exits. And this is the best technique to do that. This is a little bit more intense than the auto that I had you on for the last 15 minutes, isn't it?
Well, it feels good.
Yeah. So your accident, you had that motorcycle accident, it took you a long time to actually get the surgery on the hand, huh? Have you been suffering for a long time?
This was like a scheduled surgery, which is
Okay.
like the second or third surgery.
Oh, it is. Okay, you've
Yeah.
had a few already. Okay. Now we're going to use a light technique here called Thompson technique to adjust the sacrum and open up that space even more. So, just a simple movement right here. So if you're someone that has pain shooting down your leg from Facet syndrome, which some people do, this would be a really great technique that would alleviate all your symptoms pretty quickly. Most people get better, they see at least a minimum of 50% pain reduction in 4 weeks. And I'm talking like even severe post-surgical cases, post-surgical back cases, so even severe cases of stenosis. Typically, we see at least a 50% improvement in 4 to 5 weeks max. So that's what you should be expecting in the least. You're probably going to get better results faster than that, okay?
Good.
Just want to make sure you maintain, the right expectations here, okay? But we're going to get you through this. You're going to be fine. Now watch. Remember when I bent your legs before? You felt that pressure in your lower back and you have to lift your butt up in the air? You lift it still a little bit, but how is that now?
Better than before.
Much better, yeah, good. Okay, let's have this left side up. And you're going to bend this top leg. Good, straighten your bottom leg. Relax yourself here. Okay, other side up. In this adjustment right here, I'm actually going to take his sacrum and pull it down and open up that L5S1 junction there where the nerve root, the facet, and also the foramina where the nerve comes through. We did some flexion distraction for him, but we're really doing a lot of different techniques here to try to get him some pain relief for the weekend here, for Super Bowl weekend. And relax here. Good. All right. Lay on your back. I want you to stand up and see how that feels. Before you couldn't even sit upright. So go ahead and try to stand up. It's a lot easier. How's that feel? It's going to be hard at first getting up off the table, but see if you can stand up straight. You feel like you can stand up straight? Do you feel bent over right now?
I feel like a sharp pain.
What's that? Right in through here?
Yeah.
Okay. Come on over here. Have a seat right here facing that way. Yeah. And just lay straight back. Yeah. There you go. Cross your arms in front of you. This is the surgical hand here. Okay. Now, what I want you to do is tuck your chin, tuck your shoulders, take a deep breath in. Good, I got you. And blow all the way out. One more. Deep breath in, and blow out. All right. Now, just take a deep breath in and out, and then I'm gonna have you stand up again. I want you to roll over to your side though. So roll over to your side, yeah, push off the side and come up that way. There you go. You know how to do that. Somebody taught you how to do that before. All right. Okay. How's that feel? Can you take a deeper breath now? Said you were having a hard time taking a deep breath in earlier too, right? So I adjusted the vertebra right alongside the diaphragm to give nerve supply to the diaphragm. So it should be easier to get a full breath in right now. Okay, go home, take it easy. We'll see you on Monday.
Okay.
All right, we'll get you through this in a couple weeks.